SOMCAN before I pass it to Zach. As you guys know, SOMCAN is a multi-issue and multi-strategy organization that nurtures the lives of youth, families, individuals, and workers. We work on a wide range of issues from tenant rights to community planning to Filipino language access to workers' rights. And we provide culturally competent direct service ranging from tenant counseling to family support to youth empowerment and workforce development. For us here at SOMCAN, we believe in uplifting the voices of immigrant, people of color, and low-income communities so they will be heard in local policy-making decisions, and so civic offices and are accountable to their needs. Also, we believe in uplifting the voices of our communities because we want to make sure they are part of defining what the changes they want to see in their communities. We don't want to talk for them. We want to do this work with them, right? We feel all of us have a voice that we need to bring to City Hall or our local politicians and that we all can speak for what we need and what our communities need. So, just for SOMCAN during the late 1990s, spurred by the dot-com boom, many parts of San Francisco was reeling from rapid gentrification. SOMA is one of the last neighborhoods that was affordable, but then, due to the dot-com, that quickly changed. Suddenly, we were unaffordable. Many small business, nonprofits, immigrants, working class residents, and their families that have called SOMA home since the early 90s were suddenly facing displacement. And we're still seeing that today, right? So in 2000, as a direct response to the increased threat in the sustainability of the SOMA community, SOMCAN was formed by community leaders from youth, seniors, veterans, Filipino, and housing organization to address this gentrification and displacement issue. SOMCAN built a resident base that would educate, organize, and mobilize the individual neighborhood in fighting for their basic human rights to live, work, and thrive here in SOMA and also in San Francisco. Since inception, SOMCAN has been able to achieve major victories with the community. I will now pass it to Zach to start off the presentation. Thank you.
All right, thank you, Adijel, for that introduction. Can we move to the next slide, please? So as mentioned before, SOMCAN received funding from the Bay Area Air Quality Management District to study air pollution and traffic congestion in the South Market. So why study SOMA in particular? As evidenced in the map to the left, SOMA is disproportionately impacted by air pollution in comparison to other neighborhoods in San Francisco. You can see in the map that SOMA is pretty much all yellow and red, which indicates that it has a higher exposed to a higher amount of air pollution than other areas in San Francisco. This is due in large part to the fact that SOMA is crossed by three major freeways: Interstate 80, Interstate 280, and Highway 101. In 2018, SFMTA estimated that 450,000 vehicles commuted into San Francisco every day. While this number applies to the whole of SF, we can assume that many of these cars are passing through SOMA, with workers commuting toward the financial district, the civic center, or the various tech companies that are located in SOMA. Next slide, please. So due to urban planning and city design, low-income and communities of color are more likely to be exposed to pollution and other environmental hazards, and this is evident in the case of SOMA, where 35% of households live 200% below the federal poverty level. One study found that the flow of traffic in SOMA was 72% greater than the city average. With all these vehicles passing through SOMA each day, You can imagine that this traffic produces a lot of pollution. Residents and workers of Soma have to breathe this air every single day, and research has shown that long-term exposure to air pollution from traffic can lead to chronic health problems. Next slide, please. The effects of traffic congestion include air pollution, noise, and safety hazards. All three of these things can impact your health, safety, and well-being. For instance, long-term exposure to car exhaust can lead to asthma, nosebleeds, headaches, fatigue, nausea, chest pain, and even cancer. Noise increases stress levels and disturbs sleep. Long-term exposure to noise is linked to diabetes, hypertension, heart disease, and depression. Chronic health conditions like diabetes and heart disease are often thought of as resulting from a lack of a healthy diet and exercise. However, your environment can also affect your susceptibility to developing these health conditions. Lastly, one study found that Soma is the second most dangerous neighborhood for pedestrians in San Francisco. The more cars there are, the more likely an accident will happen. Over the 5-year period between 2016 and 2020, Soma experienced 480 crashes, the highest out of any neighborhood in SF, and traffic-related fatalities actually increased from 2021 to 2022. I'll pass it on now to Ate Ruby.
Great, thanks, Zach. Can I just get a thumbs up from Zach if the audio is okay on your end? Great. Okay, awesome. Thank you so much. And before I go over the next slide, I just wanted to also thank SOMCAN and all of our community partners, including Zach, who's a PhD student at UCLA. It has really been a privilege working on this community assessment, looking at air quality and traffic congestion. So for this community assessment, we asked the following key questions from the perspective of residents, workers, and visitors. So first, we wanted to understand community members' experiences with neighborhood traffic conditions and air quality. More specifically, we asked about how traffic and air quality affects their daily life, their health, and their wellness. And because green spaces and parks can improve the quality of life and mitigate exposure to poor air quality, we also wanted to understand community members' usage, attitudes, and barriers towards outdoor recreational spaces and parks in the neighborhood. Finally, we wanted to hear about community members' recommendations to improve environmental health, safety, and quality of life. Next slide, please. So to gain a robust understanding of traffic congestion and air quality, we collected both quantitative and qualitative data using surveys and interviews. We collected 350 surveys from 3 target groups over a 2-month period. Surveys were translated into multiple languages, including Spanish and Filipino, and translation aids helped with interpretation and translation for other languages. We also conducted 5 follow-up interviews following the 2-month survey collection period, and interviewees were chosen based on the length, quality, and content of their survey responses, particularly as they related to the themes of health, pedestrian safety, open space, and community development. The 5 interviewees included 2 transitional aged youth, 2 adults, and 1 senior, and the interviews lasted about an hour and took place on Zoom or over the phone. Next slide, please. So this project was truly a collaborative community-based effort, and our trained community health ambassadors collected most of the survey data. The community health ambassadors are all multilingual, most in Filipino and English, and they represent different age groups. And many and the majority of our trained community health ambassadors are rooted and have strong connections to the South of Market community. Data was also collected and analyzed by SOMCAN staff, research interns from USF, UCLA, and San Francisco State. Finally, social media, community events, and other electronic platforms were our primary outreach methods. And these pictures are just a few examples of when and where we conducted some outreach to collect the survey data. Next slide, please. So this slide presents some basic demographic data to describe the 350 survey respondents. On the top left-hand box, you can see we tried to have a balance of residents, workers, and visitor voices. with about a third identifying as one of these groups. On the left-hand bottom box, almost 2/3 of the survey respondents were Filipino, and another 14% identified as Chinese or part of another Asian ethnic group. And an overwhelming 85% of residents reported living within 2 miles of a freeway, and of these, over a third live within half mile of a freeway. The majority of survey participants were adults, with 31.5 representing elders or those who are 65 years and older, and just under a quarter were between 35 and 54 years. Next slide, please. Great. So we asked SOMA residents where they live, and this map is a visual representation showing where they reside. You can't really see it, but on the far left-hand side of the map is Highway 101, and the darker, thicker, grayer line that runs northeast on this map, or diagonal on this map, is Interstate 80. So you can really see how residents are disproportionately impacted to poor air quality because of their close proximity to the freeways. Next slide, please. When asked about traffic impacts, safety, and health, we found that SOMA residents report headaches and asthma as the health issues they experience most often. More than half of residents walk or take transit as their primary mode of transportation, and less than half report accessing parks only one time per month. Next slide, please. Okay, so in this slide, you can see that all groups, residents, workers, and visitors, report hearing traffic noise always or very often. More than a quarter of all groups report that traffic noise disrupts their concentration, and over a quarter of residents say that traffic disrupts their sleep. So exposure to traffic congestion and noise can definitely have health consequences because of the disruption to their sleep and their concentration. Next slide. We learned that half of residents and 62% of workers and 44% of visitors experience problems walking in the South of Market neighborhood, with 8th and 6th Street being the most cited as having unsafe crossing intersections. Next slide. Oh, and now I'd like to pass it over to Zach, who's going to talk about the major themes from this assessment.
Yes, of course. So first, we'd like to show the short video from a community member who lives and works in SOMA. Let's hear what Michael Ruiz has to say about traffic in SOMA.
Hello, my name is Michael, and I'm here to participate in SOMCAN's effort into addressing air pollution in the SOMA due to traffic congestion. I feel like it's very important to address the issue because it affects everybody in their everyday life. Off all the way from high school, I used to take public transportation every single day, and it was really hard to get from one place to the other because, as you know, San Francisco isn't the biggest spot. It's 7x7, but because of traffic due to cars and everyone trying to get to school, all these cars would make going to high school very difficult. It used to take like about an hour just to go from my house all the way to Lowell, and I live in the SOMA. And then even stemming till now, when I leave the city or when people I know go to work, they're constantly stuck in traffic because of rush hour, and because of rush hour, all these extra fuels are just being wasted sitting in their car. A lot of money is being spent on these fuels, but also all the emission from these cars. They're stuck in one certain area because of where the traffic is. It's usually around the bridge, it's usually around freeway exits, freeway entrances, and these are all relevant in the SOMA. The SOMA has quite a few different freeway entrances and freeway exits, so with all that traffic going in and out, it's just bad for our air and bad for our economy in whole. Yeah, thank you.
All right, perfect. So through our assessment, several major themes emerged through our survey research. Next slide, please. So the first thing that we found was that traffic-related air pollution disproportionately affects residents in SOMA. While we already established that flows of traffic in SOMA are much higher than the city average, these effects are compounded by the lack of air purifiers and filtration units in the buildings where residents live. As evidenced by these two quotes, residents are aware that the lack of these treatments leaves them more susceptible to air pollution. Next slide, please. So our survey data also supports the idea that cars greatly endanger pedestrian safety in SOMA. Cars disregarding pedestrian safety is a particular risk for seniors and people with disabilities, who reported in their survey responses that they need more time than is allotted to cross the street. Many respondents also requested that community ambassadors or crossing guards be stationed at busy intersections, especially along Mission Street, to help enforce traffic laws and protect pedestrian safety. Next bullet, please. Aside from producing air pollution and endangering pedestrian safety, cars speeding down someone's alleyways also produce a lot of noise, greatly disrupting the sleep of residents. In addition to cars, the high levels of construction in the neighborhood exacerbate air and noise pollution and hinder walkability along sidewalks. Construction not only forces pedestrians to walk in the streets, but it also closes lanes for cars. As a result, cars sit idling in the streets, producing more car exhaust in that particular area. Next bullet, please. Survey respondents brought up that improving access to public transit is one way that traffic in SOMA can be reduced. However, several respondents expressed that buses would not arrive on time due to traffic congestion, making them late for work, school, and medical appointments. In response, many participants discussed the need for improving accessibility and reliability of existing transit lines. Next slide, please. Several respondents noted the lack of green space in the South of Market. SOMA is located in District 6, the district in San Francisco with the least amount of parks per capita. Access to green space is not only important for providing fresh, clean air for residents and visitors in the area, but also for providing recreational space for children, seniors, and families. Many low-income families in SOMA live in densely crowded buildings due to the high cost of living in the downtown area. Parks and playgrounds form a pivotal extension of these families' households, fulfilling the role of a backyard by allowing children to play outside. However, one interviewee reported that the parks and playgrounds adjacent to his residence are not well maintained or cleaned, disincentivizing their use and alienating him from his own neighborhood. Next bullet, please. To address these issues, several respondents indicated the need for collaboration between city agencies, community-based organizations, and community stakeholders. One interviewee recalled the effort to instate a crosswalk by the Canning Kip Senior Center and saw this as a model for future solutions to address traffic congestion and air pollution. I'll pass it on now to Ate Jel to describe in some detail a couple of the recommendations that SOMCAN proposes.
Are we on? Okay, sorry. Okay, but before I go into the recommendations, I forgot to mention if for folks that are on Zoom, you guys could write your questions on the chat and we'll respond to it. So I'm just going to summarize the recommendation and the report. However, to really know and understand our recommendation, please read the report since it outlines in length our recommendation. And we also, you could pick up the report at our office, or you could go online on our website and get a copy through that. But yeah, definitely we have a lot in our office. Excuse me. So our first recommendation is adopt bolder measure to incentivize public transit use. We recommend a fare free public transport and reevaluation or expansion of existing transit subsidy programs, improve public transit services that focus on performance and reliability, safety, and maintenance, and transitioning to a full-on zero-emission bus fleet, as well as strengthening community partnership with local and state governments. Some examples are transit subsidy and benefits program. For communities to learn about the different programs that SFMTA has, we recommend that they actually hire language-specific staff of that to increase the support and outreach to all of our communities, the Filipino community, Chinese, Spanish, right? And this is also part of the San Francisco Language Ordinance. So the other thing we want to recommend is, you know, for SOMCAN, we've been advocating for, we were part of the advocacy of Free Muni for Youth, and we supported senior and disability action on the Free Muni for seniors. For us, why don't we just make it free muni for everyone so it's more accessible for all of us? We see that expanding this program can really help resident and commuters to take public transit instead of driving. And this, in our effort to reduce carbon emission, fare-free public transport system has been adopted internationally and domestically, yielding increases in ridership. So we saw this happening already in European Union, 2 nations, multiple local municipalities, and we would like to see that happen here in San Francisco, which is, you know, one of the cities that makes really bold changes, right? The second thing we want to recommend is prioritizing innovative traffic calming measures and initiatives in the Southern Market. We recommend that the city continue to prioritize traffic calming measures and initiative in SOMA, implementing changes in road infrastructure and expanding SFMTA's residential traffic calming and slow streets program. We are very happy to share that finally, the SOMA Slow Street has been reinstated in Mabini, Lapu-Lapu, Rizal, and Tandangsora Street. But it would be great to see that in other parts of SOMA that residents want to see that. And of course, we also want to recommend that the residential traffic calming program, the application to be more reconsidering the eligibility requirements, so more SOMA streets are actually can apply for that. So we really recommend for SFMTA to work further with us on that. The third thing we want to recommend is increase green space in the Southern Market. As we know, we do have Victoria Manalo Draves Park and South Park as 2 full parks in the Southern Market, but we need more than that. We have more than, I believe, 30,000 residents here, and we're still have the lowest capita of green spaces per residents. So we need to see more full park. And what I mean about full park is there's a children's playground, there's a basketball court, and other things, right? So we want to see more of that here. And we also recommend that the San Francisco Planning Department include more SOMA streets within the Green Connection Network. The Green Connection Network aims to promote access to San Francisco parks and green spaces by creating a series of green connectors, recognizing that streets were designed to prioritize flows of car traffic over pedestrian and bicycle. The Green Connection Network aims to invest in traffic calming measures that are pedestrian and bicycle friendly and transform major roadway into greenways that incorporate more trees and vegetation into the street. The fourth recommendation is invest in community leadership training programs to promote traffic and road safety, adopting community-based alternatives to such as community traffic ambassadors in the neighborhood, which could generate stable employment and increase social capital among community members. So that's basically like, you know, in the school year, you guys would see the school guards, right? Helping that, but how about if we have that more in heavy areas on Mission Street where it'll help seniors and everyone walk safer, right? Because sometimes some of the lights, even though there's the light blinking, some of the seniors are still having a hard time, you know, getting through that. And our last recommendation is provide air purifiers or filtration units to all low-income SOMA residents. Currently, the Bay Area Air Quality Management District and RAMP has an air purifier distribution program that requires that recipients be low income and diagnosed with asthma or other respiratory conditions. So if you have any of those, you could apply for this program to get an air filter. However, we're also trying to avoid people getting sick, right? We already know we live or work in a high area of traffic congestion. We're recommending they instead change that program to let everybody qualify as long as they're living in the proximity of the freeway, so they could have access to that. We want to see more preventive measures, right? So we're recommending that they change their application and recommending that they let everybody apply for that. We're also recommending that the city itself looks into ordinance or legislation to mandate a lot of these building owners to inform their tenants about the air purifier program, and also for them to have accessibility for that, and to really work with the city to give that to all their tenants in the building, especially for folks who are living in very close proximity to the freeway. I'm gonna pass it back to Ruby.
Great, thank you, Angelica. So just to conclude, we must prioritize public health and center equity in our city policies and decisions. This is especially true for our most vulnerable and socioeconomically disadvantaged communities who are most impacted by environmental injustices. We must support strong climate goals of reducing greenhouse gas emissions at the local and state level. And then finally, this assessment and its recommendations serve as a guide and foundation for policies to build a more sustainable, livable, and equitable city for today and tomorrow. Next slide, please. And then we wanted to end on this quote from one of the transitional aged youth who lives in the SOMA. And this individual believes that we should all align businesses and companies to push sustainability in all aspects for a thriving and safe neighborhood. SOMA is a powerful and lovely space. Let's keep it that way. And that really concludes our presentation. And we thank folks for their time. And we'd love to open it up for discussion and questions at this time.
Can you guys turn on your mic? Yeah, there's a question on the office.
Oh, okay. Somebody was asking how the air purifier program works. So right now, you have to go to this the Bay Area Air Quality website and fill in their application, and also show that you have asthma. That's why you need this. So our recommendation is it shouldn't be that you already have asthma to access that. You should be able to apply for that as long as you're living, let's say 1 mile away from the freeway. They should change their requirement because we want to see everybody access that, not just when you're sick already, but we want to see prevention for. All right. I guess there's no question. Meron pa pong question dito? Yes.
Kaya parang, kasi kung ngayon din, dati
Way mo?
parang nag-relate sa amin natin eh.
Opo.
Kasi ano ko, my understanding, it depends how nila yun. Ano ba naman?
Angelica, can you rephrase the question or comment that was brought up by someone on site?
Yes, hold on. Let her finish.
Hindi ko siya explain, parang ita-transition tayo sa ganun, kaya mas like hindi ko the environment.
Yes,
Yes.
it's the Green New Deal.
Also, there's the Green New Deal that she was reading about, and that one of their goals is in 2035 to have energy efficient cars. And it'll be great too if we have, that for all the buses, right? The zero emission and other things.
I don't see this thing. Another day I
She was also commenting how there's driveless cars now in San Francisco. So, thank you again for joining us, and definitely, we created this report to make sure we start really thinking about our environment, our neighborhood, because we're not, there's definitely initiatives that's happening. We're seeing some of the roads, some of the traffic calming, but we need to see more of that, right? And then we also, for us, we know there's a lot of budget cuts in the city department, and that's why we're really encouraging the state to step in to provide funding for transit needs of different cities and regions, right, in California. And we want to see some of that funding to come to San Francisco to make sure that all of our existing programs, like the Free Muni for Youth and Seniors, continues, but also low-income transit riders. And we want to make sure that, we don't forget about moving forward to a place where we could really have a free transit for everyone. And that, here in the South of Market, we see people are thriving and are healthy. And these are some of our recommendation here might change in the future, but we see that these are just a key few steps that we want to work with the residents and also our city leaders to make this happen. And again, we already saw one happen, the Soma Slow Streets, and would like to see more of the recommendations here, because these recommendations are not from us, it's actually from people like you who filled out the surveys and really help voice out your opinions and really help and the researchers really help find different cities that is happening, and it's doable, right? We see a lot of this happening in other parts of the state or internationally and domestically, and we want to see it more here in San Francisco, with SOMA as being the starting point. So thank you again for joining us, and if there's no question, Ruby or Zach, do you guys have any other things you want to add? You're muted, Ruby.
All right, I was saying, Zach, do you want to go ahead and then I can wrap up?
No, nothing much that I have to say. Just it's been a pleasure being able to work with SOMCAN on this report, and I look forward to seeing how we can use this report as an advocacy tool to improve air pollution in SOMA.
Absolutely. And I just want to say that the SOMA neighborhood is a wonderful neighborhood. I feel like I've been welcomed. I don't live in the neighborhood, but both of my children attended Bessie Carmichael. So Monday through Friday, we were there taking the bus, and we firsthand experienced how pedestrian safety is an issue, right? And for the residents who live there, you know that there are major freeways that run through the neighborhood, and the exits and entrances for those freeways are right next to the middle school campus and the elementary school campus. So air quality and exposure to air pollution is important, right? It needs to be addressed. And while those freeways may not get removed, if we can increase green spaces in the neighborhood, that is a way to kind of capture the carbon dioxide that's in the air, right? So again, mitigating the poor air quality in the neighborhood. So I too am hoping that this report will be a great advocacy tool for organizing and to put pressure on our policymakers and politicians to make change in the neighborhood. Thank you.
Thank you, everyone. Okay, bye.